Super. So, social care, Healthwatch. I guess the clue isn't in the title. But of course, Healthwatch is here, people who use social care service. David and I had a really productive and kind of constructive conversation about how we can start to do some testing out again in social care services and start to think about how we can make sure there's a really rounded conversation about health and social care services and how Healthwatch are involved in all of that. And I think that's particularly critical over the next couple of years as we think about some major changes that's going to need to happen. Now, I wanted to talk a bit about some kind of context of social care and a bit about where social care is going and how Healthwatch can help with that. And something may or may not happen when I press this button. No. There we go. Super. So when I started in social care, I started as a care worker in a Victorian long-stay hospital. I then worked as a social worker to support people to move out of that long-stay hospital into services that fortunately also closed. And I think for me that was something that social care is always changing. And part of it has struck me because the way it's changing is services are moving from being very visible to that asylum on the hill that everyone knew about is outside of every major town or conurbation in this country, through to services that are very invisible. I had a lovely story the other week of someone in one of our rural communities who has dementia. And we'd done a piece of work with this lady and her daughter to think about how she could be kept safe. So one of the things she did was she wandered out of her house. And what we've got is a watch with a GPS tracking device in it. And what we've agreed is that she's familiar with the village. So when she walks about the village wearing the watch, nothing happens. When the other day she headed out of the village and up a lane onto the fells, it sent a call out to the call centre, and her daughter went and found her mother and brought her mother back into the village where she continued her walk. That's a completely invisible service. Apart from that lady and her daughter, no one knew that she was receiving a social care service. But that was keeping her safe and that was keeping her connected with her local community. And that's happening across Cumbria. We're seeing the way we use residential care decreasing, the amount of service and the types of service we use to keep people in their homes increasing and changing rapidly. And I think there's a real role for Healthwatch in helping the public debate about that and helping people understand how services change. Because there's a reality, which is most people in Cumbria don't use social care services. They are very, very important to probably 25,000 people who actually use those services across Cumbria. About 15,000 of those people receive some kind of financial support from the council. Other people receive some services from the council and pay for themselves. It's really important to those people, but for most people it doesn't touch on their lives, or only come into contact with those services at a particular point in their lives. But when they do, there's usually a crisis. And actually that's not always the greatest point to start to think about, well, how do I co-produce a solution? How do I get into a kind of conversation and feel that I'm in control of my life? But that's really, really important. And so I think one of the things that Healthwatch can help with is actually to raise the kind of level of information and understanding that people have about what might be available should they need it. Because increasingly those things won't be visible. They won't be able to point to the asylum on the hill and say, aha, I know when there's a crisis, that's where I go. Instead, it'll be quite different. And there's something I think about how we can kind of make sure that the service is not just the right service, technically, it's well delivered, but that actually people felt they had a role in co-producing that. And when I think of my own experience and my family's experience of healthcare services across Cumbria, actually we've had some really good technical solutions. They've been really good, they tick all the boxes. In one instance, we also had a really good experience during the birth of our elder child, where things weren't going very well. There's a real sense in which actually the service wanted to engage us in, so what's going to happen next, and did a bit about it. You've got a birth plan, but actually it doesn't feel following the birth plan to the letter at this point is going to be a great solution. And they did a solution which actually wasn't just technically correct, our daughter was born well, but actually they engaged us in the process. And that, I think, is one of the really important things that Healthwatch can bring to this debate. So working in the future is going to be about raising public awareness. Social care in the next few years is going to go through profound change. Many people have heard the national debate about the changes in funding for social care. that's going to touch on everyone who uses social care services. More critically, it's also going to prompt a debate about how do people understand their options, how do people start to plan more for what is fairly inevitable in life. And through that, we need to start thinking about how we deliver services differently and promote them. We really challenge, I think, public aspiration about quality of services. I was very struck, we were doing some work around changing residential care services in Cumbria. And one of the things that a number of family members said is, but our mother-father grew up with a toilet at the end of the garden. They don't need an ensuite toilet. They don't need an ensuite bathroom. You know, kind of sharing with 6 or 7 strangers is fine for them. When one of those people moved out into an extra care housing scheme where they had their own 2-bed floor ensuite, they said, I didn't know I missed having my own toilet and not having to share until I got it back again. And so there's something about how we kind of not just have high quality services, but how we raise people's aspirations about the quality service that they will get. And there's lots and lots of evidence about what works well. And sometimes that really does challenge people's perceptions about what works well. Lots of experience about how environments that people with dementia can have a very profound impact. Bear with me, another brief story is of a gentleman in a care home who's had quite a significant level of dementia. His behaviour at meal times was really quite challenging. He became very distressed and did a number of things that really challenged his dignity. But the issue was that he couldn't see the food on his plate. We were using white plates, perfectly sensible. The sorts of foods we were serving were often quite pale in colour. He couldn't see them. All he could see was other people at greater distance getting their meal. We did some very simple design changes. He then could see his meal, could feed himself, and had a much more dignified way of life. So sometimes it's about some very small changes we need to help people to think about. And challenge ourselves throughout reflecting on our services. So some future priorities. Integration is big, there's kind of counter-council, CCG, NHS commitment around integration. We need to have a lot of debate about how we have kind of self-reliance, about community reliance, about when people use services, what the nature of their services looks like. But more critically, how we can kind of co-produce solutions to services, how we can think about changing the nature of debate. And my final kind of observation, I'm conscious we're going to finish at 12:30, was that I have a young family. I had lots of information about the basic pieces of equipment I needed to keep safe in the, keep my children safe in the home. I didn't need to go to health and social care. Yet if I needed some similar pieces of equipment to keep me safe in my own home in older age, actually currently we can't help people take control of that. Point people to very simple things that are easy to fix and to change their environment. And that's part of, I think, again, in the debate is how we really open up a conversation about what is change, what that looks like, and actually what those aspirations for the future will look like. And that applies equally, I think, to health and social care services. So thank you. I really look forward to working with Dave and the team on how we're going to make that happen over the next couple of years.